but I can imagine there may have been some misconception that you find among our peers, such as, lifestyle medicine approach cannot be that effective like traditional medicine. What are other main misconceptions that you find within our peers when it comes to lifestyle medicine?
So, as I said, lifestyle medicine, it's a fairly emerging field of medicine. It's only been around for 20 years, whereas most of the other ones have been around for at least 100 years or even longer.
Yeah,
So, perhaps people, one, they haven't even heard of it, a lot of
right.
them. And then the ones that have are a bit skeptical because it seems that the things that we tend to push and believe in kind of seem adjacent to, non-conventional fields of medicine that perhaps don't have the same evidence base.
Right.
But one thing that I would just want to stress is that lifestyle medicine is actually a field of conventional medicine. So we're an evidence-based field. We use scientific evidence. So there's, clinical trials, systematic reviews, meta-analyses, the highest level of scientific evidence that's available here.
Yeah, and that's very important to mention. Thank you for mentioning that, because it's just this is evidence based. To be a lifestyle medicine practitioner, primarily, of course, you have to be a lifestyle. You have to be a doctor. You have to be a physician. You need to go through, medical school. And lifestyle medicine is not a mess. It's building up on the core knowledge, the physiology, the anatomy, pathology, and all kind of things. But now we know better when it comes to pharmacology. We say, hey, yes, we do have certain medication that do save life, which is great. But hey, there is another way. This medication invariably does come with some side effects.
Exactly.
But if you change your lifestyle, you don't have necessary to undergo these side effects.
Yeah.
Hence, I believe, I think one of my favorite lifestyle medicine doctor, Michael Greger, saying that if this lifestyle change can do all these things, talk about heart disease, diabetes, hypertension, shouldn't this be the lifestyle of default? Can you just start with this before anything else? Because no one is going to be harmed necessarily by adopting this, but the only side effects will be people to actually get it more better.
Exactly.
Yeah,
exactly.
So that's how I like this. So when it comes to of course, whatever misconception that are there, of course, people need to be referred to the scientific research. And I think often doctors, we're so busy to be able to go to peruse to understand the latest research. But also there's a competition, you're competing with so many other pharmaceutical industries who literally do also write their own reviews, some papers. We know how some research may be skewed in a certain way.
Yes.
So, but one have to be really a student again to learn about this. But evidence are there. And the same talking about how it is on about 20 years or so. But evidence has been there. I remember, for example, talk about heart disease in the US. It's number one killer. But we know, I think Dean Ornish demonstrated how how a heart disease shouldn't take place to start with. We're talking about coronary artery disease. But if it happened, it can actually be adequately reversed. That has been more than 30 years ago.
Yeah.
So they have been, of course, they are pioneer in lifestyle medicine. Some even call it preventative medicine, but I think the formal school of the College of Lifestyle Medicine, that's what it has been more like the 20
That's
years.
the 20 years, yes.
Otherwise, the evidence has been there and the studies have been there for a while.
And actually, Ernest, as you say that, I just remembered that even our forefathers, like the founding fathers of medicine, they actually said that the doctor of the future will not prescribe medicine, but
Thomas Edison,
exactly will be basically prescribing lifestyle. And even Hippocrates, as early as 400 BC, he said, let food be thy medicine and medicine be thy food. So these are things that have been recognized actually for centuries and only just, as you're saying, becoming formalized into a school.
But we live in a very a good time. Of course, there are a lot of misconceptions, and that's why we have to demystify all the myths and stuff. But of course, it didn't deter you to understand how you may not be practicing at the moment. But whenever you saw a patient, you try to integrate the lifestyle medicine into the traditional medical practice. How difficult has it been integrating lifestyle medicine into a traditional medical practice?
So if I can think back to when I was practicing as a GP in Botswana, so as I said earlier, I did find that patients were very interested, like in lifestyle medicine. Everybody wants to say, what can I do? What can I change? Right. But then the resistance always comes in when they realize how much they have to change, right? If they want to see a big result. So for me, I would say how I manage that is I always met the patient at their level of readiness. So it's how much are you prepared to change today? Right? So how confident do you feel in making this change? What are the support systems around you? What are some of the barriers? If the barriers are too great, then maybe this goal is too big for now. Maybe we can scale down into a more manageable goal. But every step that you're taking, no matter how small, it's still a step in the right direction. Absolutely. Yeah. So the approach then would be to say, we're not going to stop your medication at the beginning. So definitely don't go and throw all your medicine away at home. Continue taking your medicine and then make these gradual steps. And then the more of your lifestyle that you change, then the less you will need to rely on your medication. So then you will need to come back and follow up routinely, and then based on your biochemical markers and other things that we use to monitor your progress, then we'll see, okay, we can reduce your dose of insulin. Okay, we can remove one of your high blood pressure medications. Congratulations, you're no longer diabetic if you went into the really intensive lifestyle changes.
And that is very important, especially, from how we are trained. And by the way, of course, they trained out in South Africa, but if else, or even the US, the same training seemed to be the case that we were, I remember in medical school that once you're hypertensive, you're always going to be hypertensive.
Absolutely.
Once you're type 2 diabetes, we know type 1, it's insulin issues, of course, you're likely to be long term. But even then, even type 1 diabetes, you can actually reduce the amount of insulin you take. But there is these so-called chronic diseases, and once you have it, it's going to be always the case.
Lifelong,
Now, if anything, people that are seeing this, they have to understand, no, we can change the trajectory of our life. Absolutely. Remember, if we understand the root cause of disease and be able to start changing, integrating these lifestyle practices, people will be amazed how things can start getting better. And also, it's I'm so glad in South Africa we're having more lifestyle medicine physicians that are having practices, and that way there is help. People can, because there aren't many doctors that, unless of course you're lifestyle medicine trained, that when I talk about the thing you're talking about, that to talk about lifestyle, they may say lifestyle change, but they don't believe you can actually change and be able to be starting getting better, your blood pressure coming down, and be to a point you can actually reduce the medication. So this is very important.
Yeah, that's true. I feel like they actually see maybe lifestyle change as a want to have rather than a need to have. So it's something that we can just tack on the end of, in the last 2 seconds of the consultation, you might want to change your lifestyle, but then perhaps they don't have the tools or the knowledge to know that actually these lifestyle changes can be prescribed the same way that you prescribe drugs to a patient, so that there's this very specific formula that's tailored to that patient that they can actually follow to see the benefits.
Definitely. And I like what you said, that it's the patient dependent.
Yes.
And this is one of the contrasts of traditional medicine. This is lifestyle medicine. What we traditional medicine is like, you have this, I tell you what you have, I tell you what to do.